Hey, Dr. Lori here. A new study has just come out, just last week actually, showing how chemotherapy can awaken dormant cancer cells. This study was specifically for the lungs, but what can happen is these cancer cells can essentially fall asleep for years without growing. And when someone is doing a chemotherapy, it can actually awaken these cells and induce this proliferation, essentially. And so this is a big deal because we all know that chemotherapy is very oxidative for the body, and we know it puts a lot of stress and affects our healthy cells, not only just the cancerous cells, but when we're actually showing the mechanism how we can see these dormant cells almost like reactivate from a chemotherapy, that I hope is allowing you to question the process of these toxic drugs. Not only just questioning if you should be on them or not, but what type of metabolic plan can you follow to support your system from getting rid, or your immune system to be aware of these abnormal cells and improve cancer therapies in general. So really, in layman terms, a lot of these cancer cells can essentially fall asleep. So if you think about like fall asleep, a lot of these cells, if you're supporting the terrain and you're helping keep insulin low and supporting maybe just cleaning up your diet, keeping stress low, doing a lot of the metabolic therapies to lower cancer risk. I've seen where people will do like preventative chemo, and they'd say like, just do this chemo to clean up and make sure that we get everything after the surgery. And I've never really understood that, like applying a toxic drug to the body just to clean up, just in case. And so this is where we want to look at, okay, what else can you do if your main interest is just to clean up the area and to do everything possible instead of adding more poison to the system. So one of the things that I talk about a lot is doing fasting mimicking plans. So that's where you're basically following a caloric restriction diet. And the whole point of that is to lower insulin and lower certain growth factors like IGF-1. And these triggers, so IGF-1 can feed these dormant cells essentially and stimulate their reactivation. So before you just jump into toxic therapies, if it was me, I would be investigating all of the things first prior to using that as my first resort. And these are tests that I run all the time just to see what does your fasting insulin look like after 14 or 16 hours. What does your IGF-1 look like? Like what does the level of inflammation look like in your system? So, and even just markers for angiogenesis too. So the potential for new blood vessel growth. These are all things that you can check. So basically what this study is saying is that we need to be careful because a lot of times chemotherapy can actually add more stress than doing good for the system. And so there's a time and place for certain medications and for certain therapies. But this study, June 24th, so that was almost 2 weeks ago of this year, showed how chemotherapy awakens these dormant cells. And that's terrifying. So that's awful. So the other things you want to really look at is the health of your mitochondria and your gut microbiome, because all of that plays a toll in how your immune system can recognize and fight cancer. So looking into that. And then also, if you were to go alongside, or if you were to do chemotherapy, there's certain things that you could do to help lower this risk of reactivating these dormant cells. So that has to be personalized, but there's a couple of studies here that's actually showing quercetin being one of them, and curcumin, and even resveratrol how they can support this, it's called senescent cells. So senescent cells are basically like aged and stressed out cells. These aged and stressed out cells release these inflammatory substances. And so when there's more inflammation, it's basically triggering these tumors to become reactivated. So what this is saying is curcumin, resveratrol, and quercetin have been shown to remove these senescent cells, like these aged and stressed cells, to help eliminate that risk of these pro-inflammatory substances. So there's lots that you can do. So don't think, okay, if you're on a chemotherapy that you're screwed and you're going to be, reactivating all of these types of markers. But that's where having an integrative plan is really important. And then also talking to your doctor about potentially being on the minimal amount possible, or not doing it at all. Looking at alternatives of how you can create an environment where cancer doesn't thrive, but not overdoing it. And I think that's the problem when it comes to chemotherapies. People are living in fear and thinking like, oh no, there's like a millimeter growth, and my doctor said that if I don't do this chemo, the cancer is going to blow up and be everywhere. And that fear of the cancer moving, thinking like you have to try a different chemotherapy, just knowing that there's a real risk of chemotherapy actually making the cancers more aggressive and reactivated new cells. And that's where I see this all the time, where someone comes in on a certain chemotherapy and a few months later the cancer's popped up in other areas of the body. So just because you're doing a therapy that's working right now, we still want to put in a plan of action that's keeping the inflammation low and doing everything else to to reduce these senescent cells. The other things that you could look into as far as like immune surveillance, like keeping natural killer cells high, which basically is like the monitoring system. It's like the alarm system in your body that can destroy these rogue cells, would be things like mistletoe, medicinal mushrooms, so like AHCC, reishi, turkey tail, beta glucans, and then also vitamin D. You want to have your vitamin D at high optimal levels. And then even just nutritional factors that help with your immune system. So like zinc and selenium. Even glutathione's a bit of a touchy subject because if you're doing more oxidative therapies, then you don't want to take away from the oxidative stress on cancer. But glutathione, there's a time and place for that, especially when it comes to detoxing and liver support and bringing down inflammation. So lots that you can do. I just thought it was really important that we